Dermatomes and Myotomes. Dermatomes are areas on the surface of the skin that are controlled by specific nerve roots from the spinal cord. The first one is L1. L1 is located in the hip flexor region. The next one is L2. Right underneath L1 is L2 in the hip flexor region. Next is L3. L3 is located in the center of the quadriceps muscles. L4 is next. L4 is located underneath L3, starting in the quadriceps and ending down by the plantar fascia. Next is L5. L5 is located underneath L4, but it mostly involves the lower foot region. There is no L6, but there is an S1. S1 is located down in the ankle. The last one is S2. S2 is located on the posterior side of the body. It is located in the center of the hamstring muscles. Next, I will show you myotomes. Myotomes correspond to muscles that are controlled by specific nerve roots from the spinal cord. The first one is L1 and L2. L1 and L2 both involve hip flexion. To test L1 and L2 motor function, have the patient sit at the edge of the table. The patient is going to try to flex their hip. The clinician will resist hip flexion. That would be done to test L1 and L2. Next is L3. L3 involves knee extension. In order to test L3 motor function, have the patient sit at the edge of the table. The patient is going to try to extend their knee, and the clinician will resist them. That would be done to test L3. Next is L4. L4 involves ankle dorsiflexion. To test L4 motor function, have the patient sit at the edge of the table. The patient will try to dorsiflex their ankle, and the clinician will resist them. That is done to test L4 motor function. Next is L5. L5 involves big toe extension. To test L5 motor function, have the patient sit at the edge of the table. The patient will try to extend their big toe, and the clinician will resist them. That is done to test L5 motor function. Next is S1. S1 involves eversion of the ankle. To test S1 motor function, have the patient sit at the edge of the table. The patient will try to evert their ankle, and the clinician will resist them. That is done to test S1 motor function. Last but not least is S2. S2 involves knee flexion. To test S2 motor function, have the patient lay prone on the table. The patient will try to flex their knee, and the clinician will resist them. That is done to test motor function of the S2 nerve root. Now, why are dermatomes and myotomes important? They're important because they help determine which or if any nerve root has been compromised in a suspected spinal injury. That is why it is so important to commit these sensory and motor tests to memory.